When we had previously talked, I'll get you to just do a refresher. This was a grant from the USDA. Talk about that. What did it allow you guys to purchase?
So we got a grant from the USDA, which allowed us to purchase teleconferencing equipment that we can use to connect our emergency department with those in rural counties. The purpose of this is to help keep people that are in rural settings in their hospital, not only to help the hospitals be more viable, but also to allow them, the patients, to stay closer to their families.
And talk about this component, because I know we already talked about this before, that you specifically said we bought teleconferencing equipment, because if you buy something that's telemedicine, it's a premium. So you guys use that money to buy software that still works for the job, but was cheaper. How'd y'all do that?
Well, the advantage of teleconferencing software is that it's a little bit less expensive than dedicated telemedicine equipment, but also it's easier to use. And so because you're using something that is similar to what we're talking on right now, most people can operate it. And one of the barriers for telemedicine is that the interfaces sometimes are difficult. So when you use a standard teleconferencing platform, it's easy for people to learn how to use it and feel more familiar with it, and then lower the barriers for use.
And so how have you guys been using it in the crisis that we've been facing in the last, few weeks now?
Well, it's interesting. So we are still helping those rural hospitals through this crisis. But because we had built that infrastructure of telemedicine, we were also able to bring in a different platform, one where we could talk to patients directly without having to go through an emergency department. It's more of a direct-to-consumer platform, and a lot of people are using this. We were able, though, to combine this direct-to-consumer platform with the large amount of providers we have, so that we're able to provide screening for patients 24 hours a day via telemedicine. Beyond that, which is more interesting, is that we did our own stand-up drive-through testing center, as you know, both in Richmond County and Columbia County now. And also we tied in with the Department of Public Health, so we can refer people for screening in all the districts of Georgia, not just here in the CSRA.
Wow. So I've looked on the app that we keep pushing people to do the pre-screening. So you see
Right.
a list of providers kind of in a queue for you to chat with them. How many of those providers are using the teleconferencing software that you guys got via the USDA grant?
So the USDA grant is specifically for emergency departments. So the emergency physicians are using that, but because the direct-to-consumer is a screening, we're able to use providers from all over their institutions. We have somewhere around 450 providers trained in how to use it, and we're staffing that 24 hours a day, as I said, and that's with multiple providers, as you've seen when you've logged on.
And those providers who are like online and taking those screenings, are they in the hospital, or are they, some of them, at home, like it looks like you are?
Yeah, they can be at home. That's the cool part about this, is that it's a internet-based direct-to-consumer platform, so they can be anywhere they have a stable internet connection. And so our providers are doing that if they're on quarantine, or because of educational experiences, a lot of reasons why. And so it's really a good platform because it allows multiple people to contribute to the effort of talking to people and having them get screened and answering their questions about this terrible virus.
That's such a good point, that if our providers start to get quarantined and they're at home, they can still help this way, even if they can't physically be in the hospital.
That's correct. And, this is an ever-changing response. And so as we've moved through treating people when it was, we were looking at travel history, to now we know it's in the community, this is updated on a daily basis, and we're able to tie that into the platform so that they can see the updated screening guidelines as we're updating them, so that people are always getting up-to-date information, up-to-date testing guidelines. And so far we've done, in about the last, since March 13th, we've done 3,500 or so on the screening platform, and that was from this morning. So we're probably up closer to 4,000 now.
4,000, that's 4,000 patients meeting with a physician virtually.
Yeah, a provider. So sometimes they're advanced practice providers, but yes, faculty, residents, and advanced practice providers, about 4,000 through today.
Wow. Um, yeah, Dr. Cool had talked about that. It was Dr. Miller that I talked to him that they were using their residents in this way
Hmm.
to answer some of these calls. And I
That's right.
also talked with Dean Hess and Dean Miller about students that they're not doctors yet, obviously. And now they've been removed from their clinicals, but they're looking for ways where y'all can use students to still answer calls and stuff. Will they contribute at all to this telemedicine effort or no?
So this is a all hands on deck effort. So our residents are contributing because they are physicians, so they're licensed providers, so they're able to participate. The students can't actually do any recommendations and therapy that way, but there are other ways they can contribute, like calling patients back or getting involved with answering questions and doing follow up.
So when the providers have these conversations with patients, obviously the material is protected, so I don't want to ask any specifics, but um, there is this false sense of security a lot of times with people in areas say, well, there's no reported cases in, say, Dublin, Georgia. Well, just because it's not reported doesn't mean it's not there. Are you guys noticing in some of the rural areas that these face-to-face conversations are really educational in letting people know it is, in fact, in your community more than likely?
Yeah, the rural aspect is an interesting point, and that ties back to the original telemedicine grant, because that was really to reach out to people that don't have as much access to healthcare. And so in this kind of a crisis, that it's important that they have doctors they can talk to. And so this is a way for them to reach out to a healthcare provider, get their questions answered, inform them of what quarantine is, what does it mean to be isolated, how are those different, when do you need testing, helping them get to the right place for testing. So this is a really big service to the rural areas. And as you know, Southwest Georgia's and up in the Rome area have been hit really hard, and those would be considered more rural areas of Georgia.
What numbers were you pulling up that you wanted to say? I know you had talked about the 4,000. Were there any other numbers you wanted to talk about?
Yeah, I'm just, we are, this is really a statewide program. Since it's telemedicine, there are no boundaries in Georgia, so it's not just our area. So we're able to test people outside of our area, and that is being advertised more and more. So the volume is increasing, and we would like to get that information out. So thank you for doing this. Our number of total telemedicine screens, like I said, through this morning was 3,500. Is probably closer to 4,000 now, and we've had about 1,300 that have gone through our drive-up testing. As we get this out statewide, it's going to be interesting to see how much impacts a service. This is a free service. The service that the health system is doing here in Augusta impacts all of Georgia. And so we have some maps, and I guess you can ask for those.
Kristen actually sent it to me yesterday.
Yeah, I mean,
it's amazing to see.
Statewide. I mean, the impact is huge. And so I'm really proud because I feel like, in a health system as large as ours, people want to contribute to the health of Georgia's citizens. And this is one way where they can sit in a protected environment. Like I said, their house, they may be where they can't interact with patients because they're quarantined, and yet they're still serving the citizens of Georgia. So that's really important to me. We work for the state of Georgia. So being able to help Georgia citizens, that really is key for me.
So when we come out of this, hopefully sooner rather than later,
I hope so.
Silver lining is, I would imagine that this forced us to do things that we've never been forced to do before. So when we come out on the other side and we're not dealing with a crisis, how much better do you feel like we're going to be at handling just even the common cold via telemedicine?
Well, this has been a crash course in telemedicine. And so you and I have talked before, we started this in rural EDs, and there were some barriers to overcome. But now people have seen that they can get access to their doctor for, general well-being exams or follow-up from surgery. And the technology is so easy to use. And so once people have experienced this, I think that one of the outcomes from this coronavirus is that telemedicine is going to have a larger place in the healthcare system. And I'm really excited about that because technology, as you keep seeing, with Zoom, I mean, it keeps expanding and expanding, and this is going to become easier and easier, and the barriers less and less. So one of the other good things is that the federal government has seen the power of telemedicine. So they've relaxed some of the rules on how to use telemedicine, how you can use it in your practice, what kind of people you can bill for via telemedicine. And once the federal government sees the power of this, I think that we're going to see disparities between rural and urban start to decline because of the ubiquitous nature of telemedicine products, the ease of using this. So I'm really excited about what the future is going to hold for telemedicine.
You mentioned billable codes. How do providers, I know right now it's, a free service provided because we're in crisis mode, but moving forward, if it would be, just your regular common cold, do you guys as providers have codes you can bill or send to insurance?
We do. We have codes we can send to insurance, and Georgia has parity laws, which means that telemedicine visits are paid for the same as in-person visits when appropriate. And the good thing is that the providers are getting a crash course, so they're understanding the power of telemedicine, and patients are becoming more familiar with it. And so once you've tasted how easy this is and how you can, you don't have to sit in a doctor's waiting room to get a follow-up appointment. I mean, again, I think that this is the cusp of a true telemedicine boom.
That surprises me, honestly, in a good way, that insurance companies, not to bash insurance companies, but it can be so difficult for Americans. That surprises me in a positive, that they allow in certain circumstances for it to be billed the same way as an in-person visit. That's awesome.
Yeah, Georgia's been pretty progressive in that respect. And so those laws, allow for expansion of telemedicine. There were, and there may be some more rules about, where you can bill and how you bill. But now that we've seen that it can be done in a different way because we were in a crisis, people now have experience which allows for expansion in the future. I mean, the future is very bright when it comes to telemedicine. And I think for healthcare in general, because again, people have a wariness about coming into a waiting room and exposing themselves to other germs and diseases. And if you can handle this via a telemedicine system, it's much better. I mean, the jail that we talked about, the prison system we talked about, is a key example. I mean, it's very costly for the state to bring people to emergency department for certain things that could be handled without the provider being right next to them. So we're really trying to look to see if we can save the state money on transportation costs and those kind of things by providing this telemedicine service. I really think that that's going to be a money saver for the state of Georgia.
And something you just touched on, which we haven't kind of hammered out, people are so cognizant right now of spreading coronavirus.
Right.
But even just, I mean, you know this way better than I do as an emergency specialist, the spread of infection in a hospital, in an emergency room, if you can limit the amount of people, what does that do to the amount of risk for spread of infection, even if it's not coronavirus, even if it's just, your run-of-the-mill bacteria?
Absolutely. And the thing is that, people use the emergency department sometimes because they have no other options. Having more options prevents people from using high-cost avenues for healthcare. And so this is going to help not only with infection, but just increasing access to care. People will choose the best access that they can get to. And I really think that telemedicine is one of those ways that people will be able to access care on demand and from their homes, from their work, and get the answers they need, which then increases their productivity, means less time off, and less exposure to those healthcare kind of infections.
Can you prescribe medications via telemedicine?
So we're working on our platform. It is possible to do prescriptions that way, make diagnosis and treatment. Again, there's some things that you would want to see somebody in person for, of course. But some things can be handled via telemedicine, just like we're doing, especially follow-up appointments and, post-procedure appointments. I mean, there's a lot of things that telemedicine can fill in gaps. And, some things are, you need to see a specialist. There's not any in your area. This will bridge that gap of having to drive distances just to see somebody that can treat a problem you may have where you need a specialist.
I think we covered everything and then some, right? Did we miss anything?
Well, I mean, you know, uh, I've said this, but you know, one of the interesting things about this crisis is that on the other side, it's been so dramatic that it's going to be different. Good, and some of those are bad, but telemedicine is now shown to be able to affect patient care. So this is really, it's really an outcome that is going to be a positive for, I think, for everybody. And I think that people will be able to see those, look back at this situation and go, wow, we might not have had the quickness of uptake of telemedicine if it wasn't for this crisis time we're living in.
For sure. Well, I'll let you get back to it. I know you guys got a lot of work. So thank you so much. I appreciate it. And y'all try to stay healthy yourselves because we need you guys.
Absolutely. Thank you so much. And again, please spread the word. If anybody can use the app, that's what we're here for. This is really important to us. We're really trying to serve the citizens of Georgia. And if they can use this app to have their questions answered, get the appropriate screening, that's our goal.
Perfect. Dr. Lyon, thank you. I appreciate it.
Thank you. Bye.
Okay, bye.